really need chemotherapy that would genuinely benefit from both, that would feel better, live longer if they got both. But
chemotherapy is one of the most talked about cancer treatments in the world. Yet for many people, it remains one of the least understood. You may have heard that chemotherapy is strong, that it kills cancer cells, or that it causes difficult side effects. But what does chemotherapy actually do inside the body, step by step? How does it know which cells to target? Why does it affect healthy cells? And why does the experience feel so different from one person to another? Understanding how chemotherapy works can reduce fear, increase clarity, and help patients and families feel more informed and empowered during an incredibly challenging time. In this video, we will calmly and scientifically explain what chemotherapy does to your body, step by step, using real medical knowledge and clear explanations, without fear-based language, exaggeration, or false promises. What chemotherapy is and why it exists. Chemotherapy is a category of medications designed to treat cancer by targeting cells that grow and divide rapidly. The word chemotherapy simply means chemical treatment. These medications have been used for decades and continue to evolve as science improves. Chemotherapy is not one single drug, but a large family of medications, each working in slightly different ways. Some chemotherapies damage the DNA of cancer cells, others interfere with cell division, and some prevent cancer cells from repairing themselves. The ultimate goal is to stop cancer cells from growing, dividing, and spreading. Cancer cells are different from normal cells because they have lost the normal control mechanisms that regulate growth. In healthy tissues, cells grow, divide, and die in a tightly controlled process. Cancer cells escape these controls. They continue to divide even when they should not, and over time, they can form tumors or spread to other parts of the body. Chemotherapy exists to interrupt this uncontrolled growth and reduce the burden of cancer in the body. How chemotherapy enters the body. Chemotherapy can enter the body in several ways, depending on the drug and the type of cancer being treated. Some chemotherapy drugs are given intravenously through a vein, allowing them to circulate throughout the bloodstream. Others may be taken orally as pills or capsules. In certain situations, chemotherapy may be delivered directly into a specific area, such as the spinal fluid, abdominal cavity, or bladder. Once chemotherapy enters the bloodstream, it travels throughout the body. This is why chemotherapy is often called a systemic treatment. Unlike surgery, which targets a specific tumor, chemotherapy can reach cancer cells wherever they may be hiding, including microscopic cancer cells that are too small to be detected by scans. This systemic reach is one of chemotherapy's greatest strengths, but it is also the reason side effects can occur. How chemotherapy identifies fast-dividing cells. Chemotherapy does not have intelligence or awareness. It does not know which cells are cancerous and which are healthy. Instead, chemotherapy targets a key characteristic of many cancer cells: rapid division. Cancer cells often divide much faster than most normal cells in the body. Chemotherapy drugs are designed to interfere with this process of division, known as the cell cycle. Cells divide by copying their DNA and splitting into two new cells. Many chemotherapy drugs disrupt this process by damaging DNA, blocking DNA replication, or interfering with structures inside the cell that are necessary for division. When cancer cells are unable to divide properly, they are more likely to die or stop growing. This is how chemotherapy reduces tumor size and slows cancer progression. Why healthy cells are also affected. While cancer cells divide rapidly, they are not the only cells in the body that do so. Certain healthy cells also divide frequently as part of normal life. These include cells in the bone marrow that produce blood cells, cells in the digestive tract lining, hair follicle cells, and cells involved in the immune system. Because chemotherapy targets rapid division rather than cancer specifically, these healthy cells can also be affected. This is why side effects such as fatigue, nausea, lowered immunity, and hair loss can occur. Importantly, these side effects are not a sign that chemotherapy is poisoning the body indiscriminately. Rather, they reflect the temporary impact on healthy tissues that naturally regenerate quickly. Most healthy cells can recover once chemotherapy is reduced or completed, whereas cancer cells are less capable of repair. What happens in the bone marrow? One of the most important places chemotherapy affects is the bone marrow. The bone marrow is responsible for producing red blood cells, white blood cells, and platelets. Red blood cells carry oxygen, white blood cells fight infection, and platelets help with blood clotting. Because these cells are constantly being produced, the bone marrow is particularly sensitive to chemotherapy. When chemotherapy slows bone marrow activity, blood counts may temporarily drop. This can lead to fatigue due to fewer red blood cells, increased infection risk due to fewer white blood cells, and easier bruising or bleeding due to fewer platelets. Doctors carefully monitor blood counts during chemotherapy and adjust treatment as needed to protect patient safety. How chemotherapy affects the immune system. The immune system plays a crucial role in protecting the body from infections and supporting overall health. Chemotherapy can temporarily weaken the immune system by reducing white blood cell production. This does not mean the immune system stops working entirely, but it may become less efficient for a period of time. Because of this, patients undergoing chemotherapy are often advised to take precautions to reduce infection risk. These precautions are not meant to isolate or frighten patients, but to provide reasonable protection during times when the immune system is recovering. As chemotherapy cycles progress and pauses occur between treatments, the immune system often begins to rebuild itself. What chemotherapy does to the digestive system. The digestive tract is lined with cells that renew themselves rapidly. Chemotherapy can disrupt this renewal process, leading to symptoms such as nausea, changes in appetite, diarrhea, or mouth sores. These effects occur because the protective lining of the digestive system may become thinner or more sensitive during treatment. Modern oncology places strong emphasis on managing these effects proactively. Anti-nausea medications, nutritional guidance, hydration strategies, and supportive care can significantly improve comfort and quality of life during chemotherapy. Many patients experience varying levels of digestive side effects, and not everyone experiences them in the same way. Why hair loss can occur. Hair follicles contain some of the fastest dividing cells in the body. For this reason, they can be affected by certain chemotherapy drugs. Hair loss is not dangerous, but it can be emotionally challenging. It is important to understand that not all chemotherapy causes hair loss, and when it does occur, it is usually temporary. Hair follicles typically recover after chemotherapy ends, and hair growth resumes over time. The texture or color may initially be different, but this often normalizes as the body continues to heal. The experience of hair loss varies greatly depending on the specific chemotherapy drugs used and the individual patient. How chemotherapy affects energy levels. Fatigue is one of the most commonly reported effects of chemotherapy. This fatigue is not the same as ordinary tiredness. It can result from a combination of factors, including lower red blood cell counts, immune system changes, inflammation, emotional stress, and the body's efforts to repair itself. Chemotherapy-related fatigue does not mean the body is failing. It is often a sign that the body is actively responding to treatment and allocating energy toward healing. Rest, gentle movement, proper nutrition, and emotional support can all play a role in managing fatigue during treatment. Why chemotherapy is given in cycles. Chemotherapy is typically given in cycles rather than continuously. A cycle includes a treatment period, followed by a rest period. This approach allows chemotherapy to attack cancer cells while giving healthy cells time to recover. Cancer cells are often less efficient at repair than normal cells, which gives healthy tissues an advantage during these breaks. The timing and number of cycles are carefully determined based on the type of cancer, its stage, and the patient's overall health. This individualized approach reflects the reality that cancer is not a single disease, but a complex group of many different conditions. Why chemotherapy affects people differently? No two people experience chemotherapy in exactly the same way. This is because cancer itself is highly individual, and so is the human body. Genetic differences, overall health, nutrition, emotional well-being, and the specific cancer subtype all influence how chemotherapy works and how it feels. Even within the same tumor, there may be multiple subtypes of cancer cells. Some may respond quickly to treatment, while others may require additional or different approaches. This complexity explains why treatment plans are often adjusted over time and why personalized medicine is becoming increasingly important in oncology. Chemotherapy and precision medicine. Modern cancer care is moving toward precision medicine, which involves analyzing the unique genetic and molecular characteristics of a tumor. By understanding these characteristics, doctors can select treatments that are more likely to be effective for that specific cancer. Chemotherapy may be combined with targeted therapies, immunotherapy, or hormone therapy, depending on the situation. This personalized approach helps optimize effectiveness while minimizing unnecessary side effects. It represents one of the most hopeful advancements in cancer treatment today and continues to evolve through ongoing research. Chemotherapy as part of integrative care. Chemotherapy is often one component of a broader treatment plan. Integrative oncology focuses on combining conventional cancer treatments with supportive therapies such as nutrition guidance, stress management, physical activity, is considered an essential part of modern cancer care. You are not alone, and staying informed can make a meaningful difference. Share this video with someone who may need it, and continue learning with us.